Hi, this is Dr. Jared Moss with Regional Urology. We wanted to put together a quick video to talk to you about the new telemedicine platform that we are offering called DoxyMe, and it's spelled DOXY.me. This is a telemedicine platform that's been around for several years. It is HIPAA compliant, and we are currently incorporating this into our practice to allow patients to be seen remotely. If you're like the majority of our patients, you may be intimidated by the word telemedicine, and you may say that's absolutely not for me. I need to come into the office and be seen. Well, we certainly know there are times that you may not be able to get into the office to be seen, so we want to walk you through the process. This is certainly much easier to do than most people realize. The platform that we've chosen, Doxy.me, is a special platform that does not require an app. Essentially, all that it requires to do a telemedicine visit with your doctor is a smartphone, whether this be your smartphone, a friend, or a family member. If you don't have a smartphone, and you also could use a laptop or a desktop computer. The key, though, is that these computers need to have both audio and visual to be able to complete a telemedicine visit. So you may find yourself asking, well, how is this going to work? Is somebody going to be there to help me and walk me through this process? Absolutely. So the way that it's going to work when you schedule a telemedicine visit is that our office is going to be able to walk you through the process ahead of time. We are either going to send you email or text information out and be able to walk you through the visit ahead of time to try to help you get as comfortable with the platform as possible. So without further ado, I'm going to walk you through a telemedicine visit using a smartphone today. I've included some screenshots to help you see how it would appear on your smartphone. I happen to have an Apple phone, but both iPhones and Android phones, again, any smartphone is capable of doing a telemedicine visit with the Doxy.me platform. So when you schedule a telemedicine visit, it should function exactly the same as if you were seeing us in person here at Regional Urology. You would check in with the receptionist. She would verify that you have current insurance information. Co-pays may be collected at that time. We would then provide you the information of how to go about receiving the information for the telemedicine visit and trying to do as much troubleshooting with you ahead of the time, so on the day of your appointment, everything's ready to go. For those of you who are more tech savvy, the different browsers that will work are Firefox, Google Chrome, and Safari will all accommodate the app. It is important that it will prompt you in your browser to allow access to your camera and audio in order to be able to complete the telemedicine visit. For those of you with an iPhone, I've included some additional slides to show you where to go into the settings, then go down to Safari. You'll need to access the camera and the microphone and either switch those to Ask, which prompts you each time to allow access to the camera and the microphone, which is the way that I have my settings, or you can switch it to Allow. The main thing is you just have to make sure that your settings are not on Deny. Also, please make sure that you have the most current up-to-date software on your iPhone. This is also found in the settings under the software tab. So to continue to walk you through the process, if you're on your smartphone and you have access to email, we should have the ability to be able to email you the link, and we also have the ability to text you the link. Once you see the link either in a text message or an email, you will need to click on the link. I've also included some images to show you what the email will look like as well as the text message will look like. It's important to realize that the text message may come from an unusual number, as most of you are probably cautious of clicking on emails or text messages that you're not familiar with. Please make sure to look at these images and let us know if you have any questions, but it is important to pay attention to these so that you can get access to the link. Once you found the link, you can easily click on the link and then it will take you to the Doxy.me platform. Again, you do not need an app to do this. At this point in time, your browser may prompt you to allow access to the camera and the microphone. If you want to participate in the telemedicine visit, it's important to activate both of these. Once you've entered your name, you'll be able to enter your waiting room. At that point in time, you'll be able to see whether your physician is online or offline, and they will be with you as quickly as they can. It's also very important prior to your appointment to make sure that you have a good cell phone signal or a Wi-Fi connection. You may notice that during the visit, there may be some buffering. There could be some technological issues. Please be patient with us as we try to troubleshoot this. If all else fails, then we will end the telemedicine visit. We will pick up the telephone and give you a call. This is a very important point for patients to understand, is that we ask you to make your best attempt to try to connect to us with an audio and visual component, but we will not deny you care, either if you are unable or you don't have the ability to participate in a telephone/audio encounter such as telemedicine. In that instance, we will be happy to pick up the telephone, give you a call either on your cell phone or your landline to complete the visit. On the day of the visit, after you have been checked in by our receptionist, then you will likely receive a telephone call from one of our nurses. Just like if you were seeing us here at Regional Urology, they will do your regular intake. They will ask you the reason for your visit. They will go through your medications. They will ask you if you have any problems. They will update your pharmacy and get everything ready prior to the visit with the physician. After our nurse has completed your intake, they will also do some additional last-minute troubleshooting. We hope that the majority of the troubleshooting we're able to do in advance of your visit to help the day of your visit go as smoothly as possible. If there are minor troubleshooting issues, we will take care of it at this time, and then they will get you set up and help you get into the waiting room on the Doxy.me platform for your telemedicine visit with your physician or provider. So to review, we're excited to be able to offer you telemedicine. Please don't forget, we're going to walk you through every step of the process, and if all else fails, we will be happy to pick up the telephone and still complete your visit. We're going to be emailing you, texting you instructions. We're going to be walking you through the process ahead of time. Remember that copays and deductibles may still be applicable to telemedicine visits. Our nurse will be in touch with you on the day of the visit, either through telemedicine or by the telephone to do your regular intake, just as if you were coming in to see us as a regular patient. We will then do your visit with the provider or the doctor and arrange for your follow-up, your medications, and treat any other needs that you have at the time. I hope that you feel like that this tutorial video has been helpful, and we look forward to seeing you on telemedicine.